Hi, I'm Amy Newton and this is my presentation on pregnancy and health. So, like other conditions, there are always risks to pregnancy. This is dependent on the person, any previous medical history they might have, and gestational diabetes, it has its own risks but can also occur in anyone, even if they have none of the common risks that are associated with pregnancy. These risks consist of the following. So there's women being over the age of 35 becomes more high risk as the lady gets older. Things like larger sized babies, or previously having a larger baby maybe that's 10 pounds plus. Obesity does occur when that becomes a risk as well. If say the lady had a previous pregnancy where she had gestational diabetes with that, it will keep obviously increasing as well over time the more pregnancies someone was to have. Polycystic ovary syndrome is one as well. This can also contribute towards this and cause risk to be doubled in some cases depending on the severity of those. IVF treatment, that has become one that the risks are gestational diabetes will develop with that, and obviously getting pregnant more than once, that can occur as well. Gestational diabetes, there's signs, symptoms and diagnosis for this. So you are tested for it at 24 to 28 weeks of pregnancy. To diagnose this condition, 2 tests may take place. So the first, there will be the glucose challenge test. So this just consists of someone drinking a sweet drink and then you wait an hour, you have a blood test done, and that they will check your levels of blood sugars at the time. Now, if the results are high, the nurse or doctor or any practitioner that you are seeing at the time will proceed to the next test, only if these are high. So the second test completed is the glucose tolerance test. So this will consist of a pregnant person fasting for 8 hours prior to the test, which from there the health practitioner will take a blood sample, and at different time intervals at your checkup to see how the blood glucose levels are consistent. This will only take place, as already stated, if the first test it shows that your glucose levels are high. Obviously, the possible symptoms of gestational diabetes and what to look out for when a person is pregnant is going to the bathroom a lot. Obviously, that can be a sign of pregnancy anyway, but they do say, especially in the night time, to look out for it if you're going more than what you would say is occurring throughout your pregnancy as well. Just keep an eye on that. Tiredness, obviously, again, when you're pregnant, you are going to be tired, but again, if it is tiredness that is out of the ordinary for yourself, that is something to look out for. Thirstiness all the time, it does make you a lot more thirsty in a sense that you could drink a lot more, and then itchiness and thrush around the vaginal area as well. So obviously when someone is eventually had all these tests, you've had the signs and symptoms, and the health practitioner does come to you and says, you've got gestational diabetes, they'll need a proper care plan put in place to maintain not only the health of the mother but the baby as well, just to make sure that nothing serious occurs throughout the pregnancy and at birth. Now, depending on the seriousness of the diabetes will depend on the level of care needed. The person will need to be closely monitored by healthcare professionals throughout the rest of their pregnancy, and this will consist of things like antenatal checkups more often than they normally would, as well as additional ultrasound scans, just to keep an eye on the growth and fluid around the babies is staying at a normal level. Now, all pregnant people with this condition are provided a glucose testing kit. This will just consist of them pricking their finger before and after meals and recording this in a book each time this is taken. and then this will be shared with your healthcare professional either via phone or at your checkups regularly. In some serious cases, a continuous glucose machine, which a machine attached to the skin, can be scanned and uploaded to your mobile phone, which is seen a lot in people with type 1 diabetes, but this will automatically send the readings directly to your healthcare professional if you have a more serious case of this and need to be kept an eye on even more closely. They do obviously recommend that exercise and healthy eating need to be maintained throughout just to keep those levels down and make sure there's no excess sugar being consumed within the diet, which could make obviously the blood levels higher. Medication will be administered. It's the most common, being metformin, to help just maintain the sugar levels. However, obviously, if someone doesn't agree with that medication or it doesn't work for that person, it will be discussed with your healthcare professional to see what will be best suited. In some cases, if the sugars are too high, metformin might not be enough, and there will be a medication injected into the body to help reduce this down. Healthcare professionals will monitor levels and dosage amounts, and they will just educate that person and adjust as the pregnancy goes along, just to make sure everything's in the right level. Obviously, if sugar levels can be maintained, then a normal birth can be possible. However, if this is not the case, the offer of induction or caesarean will be offered early on, just so those plans are in place, ready to go, just in case. So, next, obviously, I'm going to go on to talk about preeclampsia. So, obviously, there's varying factors in which a person may be at risk of preeclampsia during pregnancy. These can include pre-existing conditions such as diabetes, lupus, high blood pressure. Obviously, if someone was to have previous preeclampsia in a different pregnancy, again, the same with gestational diabetes, you are more at risk of getting that again and reoccurring if you've had it before. Studies have shown that women over the age of 40 are at higher risk of getting this as well. Any family history of preeclampsia, a 10-year gap, figures show that can cause preeclampsia between your last pregnancy and this one. And again, obesity is one as well. Okay, so the signs and symptoms of preeclampsia, again, they're very varying. They're most common while others are not. Again, they range from mild to severe, and the most common symptoms, most recognisable ones out there, are the protein in your urine, which will be found when a healthcare professional tests your urine at your antenatal appointments, when they're doing regular checkups, high blood pressure, vomiting. Again, that's something to keep an eye on, because obviously ladies tend to get morning sickness, but obviously if it's reoccurring, there's something to get checked out. Pain by ribs, or it can be underneath the ribs as well. Severe headaches, and then severe swelling of feet, hands and face as well are things to look out for. Obviously, those are the most common, but in some cases there are some uncommon symptoms that occur which can be quite rare. And again, it varies from person to person. So this is things like decreased liver and kidney function, fluid on the lungs, decreased urine production as well. Thrombocytopenia, also known as your low blood platelet levels, which just causes issues with bleeding as well. Again, it is all dependent on person, and in some cases no symptoms may be present, which means it could be harder to diagnose, and as a delayed diagnosis could cause problems down the line. Antenatal appointments and checks that are done as routine for everyone will mean that they can test for these things and make sure none are present at the time. Okay, so the care plan for preeclampsia during pregnancy, again, it's similar for everyone in the basis of it, obviously depending on the severity of your case, is dependent on the change of plan. So obviously once someone is diagnosed with preeclampsia, they are referred to a healthcare professional who will monitor the ongoing condition more closely for the remainder of time left in the pregnancy. If a person is 37 weeks plus when it's discovered, they may make the decision that it's safer to induce or have a cesarean for both baby and mother, but again it's dependent on the person and the condition. This obviously will mean being induced. You can still have a vaginal birth, but if tests aren't normal, and in some more serious cases, as I've mentioned, cesarean might be the only safe option. If the diagnosis is received weeks before this, however, continuous monitoring and more increased antenatal appointments again will be put in place. This will consist of obviously increasing the test of your urine, blood pressure, extra ultrasounds just to check that not only the mother but the baby is healthy and growing normally. The healthcare professional or specialist will keep a close eye on everything, as this may change and mean that an early birth is required if symptoms were to, let's say, remain or increase or get worse. So during labour, a healthcare professional may inject the mother with magnesium just in order to prevent eclampsia after birth. Again, this will depend on the severity of the condition. So eclampsia. So eclampsia is a condition in which a pregnant person can get if preeclampsia is not tended to properly or quickly enough. This is just because the blood pressure that would be high already due to preeclampsia would have meant the brain would have swelled and can lead to things like passing out. Eclampsia consists of seizures, passing out and confusion. However, it will have warning signs that should be looked out for. These are lack of urination or very little amounts that are coming out, nausea, headaches, abdominal pain. Although preeclampsia is the main factor to cause this, there are other factors involved such as being underweight, pre-existing conditions like diabetes, kidney disease, autoimmune conditions. Being pregnant with more than one child can increase the risk of this as well. Age and any family history, even your own if you've had it before. So if preeclampsia isn't monitored, it will of course lead to eclampsia, which would mean the mother may have several fits, but it can also lead to further complications that could be more severe. Some of these include stroke, blood clotting, kidney and liver failure, and also a rare condition called HELLP syndrome. This is a blood clotting within the liver. While these conditions do affect the mother, it can also complicate things for the baby, including the baby not receiving enough oxygen or nutrients, being born a lot smaller than they should be, as well as having severe underdevelopment of major organs as well. Okay, so the risk of consuming alcohol during pregnancy. So while pregnant, obviously it's recommended that you do not consume alcohol for the duration. This is just due to the risks that occur not only for health of the mother, but also the fetus and baby as well. Miscarriages, stillbirths and premature labours can occur if alcohol was consumed during pregnancy. These are not only taxing physically on the mother, but can also mentally be taxing as well. The more alcohol drunk while pregnant, the higher risk continues to grow of a miscarriage. While the risks are high for a mother, they are just as high for a baby. There are a lot of risks that could occur. These include damage to the baby's organs, low birth weight, while also impacting the growth and development of the baby, and in most serious conditions of fetal alcohol spectrum disorder, which is a condition that is lifelong and can affect a child in many different ways and not always the same way for everyone. This can range from movement difficulties, managing emotions, speech problems, and organ problems as well. Okay, so the impact of illegal substance use during pregnancy on the baby after birth. So substance abuse is not great for the body, even when people are not pregnant. But when pregnant, it does not mean there are not just risks to that person, but also the baby as well. Though all risks are worrying, some are more severe than others. So the baby could be born low in weight, prematurely, and although healthcare is always improving and able to adapt to these conditions better, it can sometimes lead to further health complications. These could be anything from mental and learning disabilities, as well as also having the possibility of being a substance abuser themselves when they're older. It can also lead to more severe conditions. These are sudden death syndrome, in which a baby suddenly dies under the age of 1 for no apparent reason. Contracting serious viruses that the mother has or had. And also something called neonatal abstinence syndrome, which means the baby becomes withdrawn from the substances that have been entering into them via the placenta, and will mean they'll appear to have tremors, feeding problems, and it could also lead to more severe seizures as well. Thank you.